Welcome back to the Evolve podcast. I'm Rhiannon.
And I'm your better host, Brendan.
All right, we'll leave it at that. But for now, pretty much what this podcast is all about is self-development, health and fitness, and our journey starting as brand new business owners.
Let's go. Make sure that you share this around because I'm telling you right now, this is the best podcast you've ever seen.
Enjoy, guys. Ciao.
Do you ever get sore with like your hands because you're always massaging and stuff all day?
A little bit. Like I think I've got a lot of, like I get a variety now at work.
Yeah.
So with babies and stuff, it's not as hardcore.
That's right, yeah.
And then also because when I'm in the water, I think that also not only is it for them, but it's also for me. Get in the water and have a move around and stuff too, which is good.
Yeah, I think the most important question that a lot of our viewers would want to know is, what is the crack?
Oh my goodness. We're starting it with all the nitty gritty questions.
What is the crack?
Normally when they say that, I'm like, it's not a crack because you can't uncrack an egg.
Yeah.
I feel like cracking does imply that there's some sort of damage that's happening.
Yeah.
So what I would say normally is that it is a phenomenon that happens. So if you've got a restriction within a joint, if you then give it a specific amount of force or a nudge in a particular way, sometimes that liquid in that capsule will then convert to gas.
Yeah.
So I call it like a joint fart, and then you give it 20 minutes and it converts back in.
A joint
fart?
A joint fart, basically, because it's a phenomenon and it doesn't really define whether or not you've had adequate treatment.
Yeah.
Because, for example, when we're looking after babies, we're not pursuing an
Joint
audible
farts.
cavitation.
Yeah.
I mean, they definitely fart when they're with me, but that's a legit fart. And it doesn't really define whether or not you've had successful treatment, right? So you're going to have other modalities that are more manual therapy based, and they're not necessarily getting what we call a cavitation.
Yeah.
But if they're then moving better, feeling better, that's a good thing. If you've got elderly people that have osteoporosis, you're not really going to go in there all guns blazing.
Looking for cracks and stuff.
Yeah. And I think that is a tricky thing because now you've got so much stuff on social media where it's all of that cracking compilation stuff.
Yeah.
And as much
with
as
the microphones on the chest and the back and stuff
you
like
can
that.
totally like dial up and dial down how much sound you're getting out of those mics, right?
Of course,
so you get some people and it sounds really
we definitely
like,
know from these, right?
yeah, that's right. And I think it's also how you use that kind of stuff. Like I understand that there's a lot of people that love watching that kind of stuff.
Yeah.
But then for me, it's like...
Well, it's satisfying, that sound.
Yeah, for some, right? But then some people are really like scared about it.
Anti-crack.
And because there's been such a misconception in how we are typically as a chiropractic profession, sometimes that then gives people that hate chiros ammunition.
Yeah.
So I feel like it's sometimes like getting that right balance of like...
It's like the wrong message of what a chiro is.
Yeah, and like are you chasing like views and like vanity metrics, or are you trying to educate people and get them in? So it's a tricky balance because obviously there are people that have managed to like really get such a large reach with that kind of content. I think it's probably reflective of like what target demographic you have, right? Whereas if I see lots of pregnant women, I see lots of babies, are they going to necessarily feel safe if they see
Looking
me
for
like
cracks and stuff like
doing
that.
like a WWE body slam on someone? And like some people love it, right? Like we get our CrossFitters that come in and our like non-pregnant paediatric demographics.
And
like,
they're just tight and locked and they need that.
Yeah, they need like definitely some sort of movement in there. That's great. But then I think if you then build your awareness around just that kind of stuff, it's a double-edged sword, right?
Okay.
Yeah.
That's actually interesting.
It's a weird thing, and it really depends on who you see, right? Like if you're in that really like early 20s gym demographic, like they're going to love that stuff. They're going to be like, oh yeah, this person's going to sort out all my problems. But
they're going to crack my spine. I'm disordered.
Yeah.
Yeah.
But then, when you have people that are like thinking, oh, is this safe for my child? Like, am I even allowed to get care when I'm pregnant?
Yes.
You know, or my baby's so small, like they can't even hold their neck up. Like, are they going to be like, I think a lot of people worry about the safety when it comes to chiropractic care and especially pregnancy and pediatrics.
Yeah. It's a very niche, industry. Was it something that you always knew you wanted to do or you fell into it?
I've always loved being around kids. Like even when I was at uni, I was teaching kids how to swim.
Oh, cool.
So I've always had a very good
background with kids.
Yeah, that's always been a thing. And then it definitely ramped up after I had my own children.
Of course.
But it was always something that I was doing, even because I've been in practice for 10 years now, but then my daughter's like 5. So easily in those first 5 years, I was still definitely seeing lots of kids and babies.
Oh, so you niched down pretty much straight away then?
No, I think I did see pretty much everything early on.
Yeah. As most chiros have to.
Yeah,
pretty
yeah,
sure.
yeah, 100%. And then I feel like it was only really in the last 5 to 6 years where I then started to have my own practice. So then I started to think, okay, well, I feel like I don't need to tell someone if you've got a sore neck or a back that maybe a chiropractor would be appropriate for you. But there were so many people that had no idea that chiropractic could really change how they experience pregnancy and paediatrics. And then I think also when you're starting out as a business and you're doing a lot of like research into like how to grow and all that kind of stuff, a lot of people will say when it comes to like social media, niche down.
Yeah.
Yes.
So that's when I thought, okay, like that's what I'm going to target. Like I do see everything, and that's why our business is called like our business name is DynamicChiropractic, because it originally was to cater for not only all of the people of all different walks of life, but also all the different modalities that we offer.
Yes.
Yeah. So that's basically how it started, and I had that business name since when I first started. So the business is technically like, because it was me contracting, 10 years old, but me having my own like shop front and like space that's mine, and if I want 50 plants I can have 50 plants. I don't have 50 plants, but I mean some patients are pretty close, but
We got one.
yeah, it's so good. Yeah, and I have the same as well.
Oh, good.
Oh, you do?
Very low maintenance, and they're great. They love water. So it's a weird hybrid because yes, I've been in the game for a long time, but then I still see myself as like a growing business essentially now, because we're in that 5-year mark. We'll be 5 years of financial year, which
Congratulations.
is coming out sooner rather than later. But yeah.
What would you say is one belief that you've found in the industry that people would disagree with you on?
Well, I guess it depends on who you're talking to.
Yeah.
Because obviously some people are going to question the legitimacy of our profession in itself. But I think the main thing, which is quite interesting, is that depending on people's attitudes towards health, it's also their attitudes towards pain. So it's not always, I don't always agree with the whole like no pain, no gain side of things. Yeah. I don't really think that health is very linear, whereas I think some people still kind of expect it to be this ongoing thing where we're building and we're not regressing. But health is also a
very
fluctuating thing. Yeah, it's your capacity, but then it's also your demand. So you're going to have days where your capacity feels high, and then there's going to be days where they feel low, and then there's going to be times where you're asking more from yourself, and then other days that you're not. So it does definitely fluctuate. But I think the main thing, especially with what I see, if we're going back to that niche side of things, I think the misconception is that pregnancy equals pain. Oh, you're getting bigger, it's all the weight, or the whole like, oh, you're getting older.
Yeah.
All these things, I feel like it's a cop-out. Like, okay, you've got a sore left knee. Like, oh, it's age, it's arthritis. Yeah, but you've got 2 knees that are exactly the same age.
Why is only one hurting?
Yeah, so there's a functional component. It's not just structural. And I think sometimes people are too quick to just put everything in a box and be like, oh, yeah, it's this disc issue that we saw in your x-rays. Like, that's why you have all these problems. It's like, really?
It's because I hit my 50s, that's it.
Yeah, hit my 50s, or I'm pregnant now. Everyone says that, pregnancy sucks and it's not great.
I'm
you
going to
just
have
have
lower
to cop
back
it.
pain or knee pain, whatever it is.
And it's like, well, no, it's also you still are in control of how you experience those things. So don't just accept what someone is telling you straight off the bat, because you know yourself better than anyone else. You have a PhD in yourself, or when it comes to kids, you have a PhD in your kid. If you think something could be improved, I'd put money on the fact that you'd probably be right.
There we go.
I hope that kind of answers. I know it's really like a long-winded way, but yes.
Definitely does.
Answered it well. Answered it very well.
They say that chiro, or we've spoken to a few chiros, and I feel like it's definitely evolved in the last, say, 5 years or so, where a lot of people used to think of it as a pseudoscience.
Yeah.
Now, you've been in the industry for a while. What was your comment on that?
I would say, firstly, considering how big my Hextet is, and that thing still makes me sweat, I would say it's a pretty much of a lazy way and a very closed-minded way of looking at our profession.
Yeah.
So we have to do minimum 2 degrees, the first one being a Bachelor of Science in general. So the fact that it's a science degree, like that's something, and we're doing subjects with medical students. We're doing subjects with, physiotherapists. They're also looking at now potentially having physio and chiros actually starting off doing the same course.
Oh, I heard
because you've
about
got
that.
all this like anatomy and physiology knowledge that all overlaps. And then afterwards specialising. And then we also do our masters. So to even become a qualified chiropractor, you've had to have a certain amount of time in clinic to tick that off. So you need to see, well, back in my day, which I'm showing my age here, but when we were trying to graduate and become qualified chiropractors, we had to see at least 300 patients. We had to do
that's a huge
certain
number.
amount of rehab plans, x-rays, all these different things to actually tick off and get our qualification. So I feel like sometimes that's a hard thing. I think in Australia, it's definitely, we're very lucky here, like our qualifications are internationally recognised quite well.
Yeah.
I think obviously if you go to like other countries, perhaps it's a little bit more wishy-washy. And I think with almost anything, there's usually a more like left side that's seen as a little bit more less science orientated, and then typically like your right side, which is seen to be a little bit more of like a research snob kind of thing. Like if it doesn't have research to qualify, like then it doesn't
Then it's not
mean
qualified
anything.
sort of thing. Yeah.
But it's like also who's going to fund for all this research?
Yeah.
yeah.
That it's a conservative modality, like, or else if you can prove that like a pill can like reduce all your pain,
Everyone
and you're
will
going to
take
make
it.
so much money. Yeah. So, I mean, yes, don't get me started on that. But I think at the same time, that's a hard thing when it is a legitimate thing and you have put in all this time, all this money, all this training, and still essentially it's science, right? Like we're still trying to evolve. Like,
Yes.
I think regardless of what you do, if you then go, oh, I've got my qualification, even if it's a physio, oh yeah, I've got my qualification, I don't have to do any more study. It's like, no, that's science though. You need to constantly have your finger on the pulse.
Yeah.
What's the research saying? Is it different? And be open to changing. So that's the thing that gets me when people go, oh, it's science, but they're so close-minded. It's like, okay, well, let's have that chat. They go, oh no, like, and they're very dismissive about it. I
Yes.
think, okay,
Like,
well,
this is my decision. This is what I think.
yeah, like now we know that, for example, there was research that said that Panadol was not effective for low back pain. Yeah,
Oh, wow,
okay.
okay.
So are we changing how people utilize Panadol at like a GP office? Like I think having a gold standard, it's not just in one profession. It should be all of us raising each other up, and
Yes.
the ability to work together is so important. And I'm really lucky that I have a fantastic relationship with many different colleagues that have different professions, because all together we all have a piece of the puzzle.
Yeah.
So it's not one or the other. It's not, I don't believe, it's not chiro versus physio. I have plenty of like women's health physios that I work with,
Yeah.
and plenty that refer to me. And I think because ultimately at the end of the day, we should all want what's best for our patients or our clients.
Yes.
And if that's with you, great, but it doesn't have to always be with you. I always say like health isn't monogamous. Like you don't have to just be with that one person forever. You're allowed to have like other people come in and give their input, and
Different
that should,
opinions.
that's going to give you the
That's
best
actually
outcomes,
a really
right?
good message.
Yes.
Because I feel like a lot of people in your field tend to think that they're the person and
Yes.
only they can fix you.
Yes,
rather
one
than
with
the
the info.
guruism. Yeah.
Yeah.
And I kind of think
I'm the guru for injuries.
100%. Yeah. And I think that's also, it's a bit of an ego thing, right?
Yeah.
But I think if we're coming back down to what's best for the patient, if you deep down know that
That
in
you're
that
not the
it's
best
not
person.
you, they're going to be so happy that you've spent the time with them and that you've put them in that right direction. Like that's what's really important, because ethically, like,
There's more of a chance I'll come back to you as well.
100%,
for a
because you were
different reason.
honest. Yeah, you said, okay, well, I can help you for this bit, but this person, let's go and send you to this person, and we're going to get more information. We're going to come back, and you're still with them for that journey. And I think that's the great thing about my job, is you do get to have a rapport with your patients. It's not just like, here's your script, see you later.
Yeah.
But I think that, it's really about incorporating those things, because at the end of the day, like, do you want to really know your rabbit hole well, or do you want to just be a little bit of everything, but you're not really?
Anything.
Yeah. So I think sometimes that's a hard thing, also choosing which rabbit hole are you going to
Go down sort of thing. Yeah.
And I've jumped into many over my career, and I don't think that's going to stop, because, as we change.
Always constantly learning.
100%.
Yeah.
Hands up would be the first person to say I'm a nerd, but it's, it's so rewarding. And that's what gives us excitement, right? If it was the same thing all the time, I can't think of anything more boring.
Yeah.
Have you always been like that throughout your whole career?
I think so.
Very
Like,
open-minded.
so yeah, I think so. I think it also depends on like who you've worked with previously as well, because you don't get, you do get exposure in terms of the last year of uni in the clinical setting, but that's only like in that area. So for example, I had a student clinic at Summer Hill, so I was only really accustomed to the demographic that's in Summer Hill.
Yeah.
Whereas like when I've worked at other locations or I've filled in for people, different areas have different kind of like people or whatever it is.
Demographic and whatnot.
100%, yeah. So it's good to have that kind of exposure to everything. But I think even like starting out, it's not like you're walking into a fully booked practice. Like I wouldn't even say I have a fully booked practice now. And I think studying was also my way of coping, because in our industry, it's not really common that you get a salary job. It's very like percentage based. So for me, I was like, okay, well, if I haven't really made too much money today, that's okay for now, because I've actually learned about this and I'm upskilling at the same time. So I thought that's how I coped previously, be like, okay, didn't make much money today, but I'm still working towards improving personally and doing my best for patients. And that also comes. And I feel like sometimes you'll go to a course about something and then you'll get like the next week, a few more of those things come in. So I also think it was almost like hopeful manifesting, but at the same time upskilling essentially. Yeah. But I think it's good to have a little bit of that, craving for novelty, because that's what makes everything so interesting, right?
100%. That's a massive takeaway though. The fact that you came out of uni and you realize that you probably won't be able to get like a full salary job that most people would want to get.
Yes.
And you're okay with taking a hit to your income and being okay with the fact that you might not be earning what you wanted to in those days or those moments, but you took away those learnings into the next day. And that's essentially what started Dynamic Chiropractic, right?
100%, yeah, because I think if you just look at it as like what's in it for you, and I mean, at the same time, I also understand I was really lucky. Like I had support from my partner and my family. So, I mean, it would be very different if you were potentially the breadwinner and it was all on you. Like obviously, hopefully like, my support network has been there for me. And then hopefully one day, like I'm going to be able to like continue to help
support
them. And it kind of
way.
is, ebb and flow. But I think that's definitely a way to kind of cope with when you're not always busy, because you're still learning. And that can also then be the piece that's going to help educate a patient a little bit more, so they then understand, okay, why do I need to follow this up, or whatever.
Why do I need to come back to Amy?
Yeah, you're always looking for different gems, right? And I think, looking at a particular research paper or something like that could be the context that someone needs to understand, like, oh, okay, like the research has now shown like I need to do whatever it is for hopefully getting the best outcome. So I think, it was definitely a way for me to cope, because I think a lot of new grads typically expect to walk into a fully booked practice, and it's unless you go rural, it's not going to happen in Sydney typically.
Wow, really? I guess it's because there's so many types of rehabilitation professions, and whenever everyone thinks rehab, they go straight to physio. That's seen as, I guess, the top person in the industry in some way.
Yes,
How would you explain to people that, just because they have the physio label, they're not the kings of the industry? A chiro can do almost the same as what a physio can.
Yeah, I mean, like typically, I can't really speak for everyone, right?
Yes.
Because some chiros are going to be different to each other, and some physios will be different for each other. And then you sometimes will have an overlap where some chiros and physios operate very similarly. We now have pretty much this, they're working towards almost having like a specialty kind of level of recognition where people can then be like, okay, I'm a sports chiropractor, I'm a paediatric chiropractor, I'm a neuro rehab chiropractor. So they're trying to almost get recognition.
Exactly the same as physios then.
Yeah.
Physios already have those titles, right?
Yeah, to be a titled practitioner, right? Yeah. So I'd also say it depends on who we're talking about, because some people will be the bee's knees and it doesn't actually matter if they're a chiro or a physio.
Yes.
Sometimes
100%.
It almost makes more of a difference depending on if you have a private health fund and what they're allowing, like what their actual provider number will say. But I often say it's also about that vibe, right? Like you could have someone that has the best rehab plan for you, but if they can't like explain to you why you need to do that, or you're still in pain, like they're useless, right? So you need to have that right balance. I think with certain things, there are obviously going to be things that physios will typically do better. And if that's what they see all the time, like that's in their sense, like that's their specialty.
Exactly.
But yeah, so I think it really depends on what it is. And if you've got a physio that typically is a little bit more hands off, so if they're a bit more like, okay, let's give you rehab so that you can take what we call active care.
Yeah.
You take that on. I've given you this program. Like it's up to you to make it what it is.
Do it on your own sort of thing.
Whereas typically I think a lot of chiropractors are still a bit more passive care initially. I kind of believe that even if you give someone that perfect rehab plan, if you're still sore, when a patient does that and it's hurting, they're going to associate that pain with the rehab, not the pain with the fact that the area is not 100% ready.
Okay.
So it's
That
about
makes
getting,
sense.
you know what I mean? Like, I hope I'm explaining that well, but
How
yeah.
would you explain to someone that doesn't understand what passive rehab is and active rehab is?
So yeah, I would basically say it's almost like active care is like things you do for yourself. Like, okay, I'm going to go home, I'm going to stretch, I'm going to go for a walk, I'm going to drink all my water, I'm going to take all my supplements, I'm going to do all these things that you as a person, you're actively doing.
Yeah.
Passive is having someone outside help and do it for you.
Okay, there we go. So
Yeah.
mobilizing joints,
Yes.
maybe
soft
helping you
tissue
with a
work,
stretch
Yep.
as well.
Taping you up, drying, whatever it is, because they're doing something to you.
Yeah.
So I almost think of active care as almost like self-help, and then passive care is you need someone else to
Like
to
external
tag team
help.
in. Yes. Yeah.
Okay. And
Yeah.
you would say that you need a combination of the two.
Yes. Yeah.
Yeah.
I don't think. I mean, yes. Sometimes you get people that are like, I don't want to do anything. I just want to come in, and then you go, okay, like you know that active care limit that's going to basically reduce how long that therapeutic effect will last for.
Yes.
But then if you've got someone that is coming in, but they're going to start doing Pilates, they're doing the stretches you gave them, they're changing their ergonomics, like they're going to typically get more out of it because they are combining those things.
Okay,
And
there we
also
go.
as a patient, you want them to be empowered, right? Like we shouldn't ever feel like we're in the passenger seat of our health. You're in the driver's seat, you decide where you're going, and you can decide the speed that you're going, but you can also decide the location of where you're going.
There we go.
You know, you're not hopping in Uber and someone's, well, I mean, even with that example, you've still decided where you're going.
Yeah.
But you know what I
100%.
mean?
So if someone comes into your clinic, you find out from that initial instance that they're not the type of person to do the extra stuff they're supposed to outside of their session. So even if you gave them a rehab plan to follow,
Yep.
they're not the person that will go and do it.
Yep.
And you realize that straight away. What's your plan with them? Are you going to make them do that rehab stuff inside clinic? Because you know they're not going to
Yeah, a little bit. But I think it also comes down to accountability, right? So it depends. If they're saying to you, oh, I'm not getting any better, what's going on? And you're like, hey,
You haven't been doing your rehab.
did you like make this change, or did you follow up this thing? Because like, you know, your work is providing like ergonomic like adjustments and stuff. Have you contacted them to do whatever it is, right? They go, okay. Like I think it depends on how they're taking that. Because you get some people that are like, life is just so busy at the moment. Like I just need help, or I need a bit more hand holding. You go, okay, fair enough. Like that might then mean like I need to see you probably a little bit more often. But then the choice is theirs, right? Or sometimes if you get someone that, like we'll sometimes get people that are like, I'm not going to do any of those things. You go, okay, well, what are your health goals?
Okay.
Like we also need to think, where are you envisioning yourself?
So you ask deeper questions.
And do we feel like our short-term actions are matching up with our long-term plan?
Yeah.
And that's also, it's more about having that realistic goal setting in that instance, because I think, it depends. Like, are they complaining to you and they're salty at you and they're saying that you haven't like done what you said you're going to do?
Yeah.
There's so many
or are they
factors.
just saying like, oh, I just feel like I need to see you a little bit sooner because I'm not ready just yet to take on these things. I've got no one to help watch the kids while I then,
That's where it
take up
becomes,
this
like,
journey.
Very case dependent in that
100%.
sense.
Yeah. And that's the human element, right? Like no one's a robot. We don't all come with instruction manuals. And even if we did, they wouldn't all be the same. So I think, it just kind of depends on the relationship that you have with the patient. Like some of them you can like give it to them straight. Other people you might have to like, coddle them a little bit. Everyone's going to be different. But so even for example, like my dad, he is this typical, I'm sorry if he then watches this, but if we had looked at him like 2 years ago, he would be your typical middle-aged white boomer who has a sedentary job, that, you know, wasn't really prioritizing his health, had all these comorbidities that, sorry, Dad, he didn't know about these things until he ended up having like a stroke a month before I had my second kid.
Oh, no.
But at least the good thing with him, to his credit, is that once he's given a plan, he will follow it. Like he's very good
structured.
like that. Yeah. So after obviously having that stroke, we then got so many things diagnosed, and then we had plans for that, and then it was really about getting all those different people together. And now knowing that he probably wasn't so self-disciplined when he was at the gym, he would just do the treadmill and the rowing machine, things that he knew. We knew, okay, like you need a PT, you need someone to keep you accountable, because your goal is obviously to get better and to lose weight, because also for him, the next goal was like, okay, I need to get both my knees done. It's like, yeah, but they're not going to operate on you if you're still overweight. So we need to also drop your weight down, and you need help with that. So then kind of knowing what will work with this person and who do we need to utilize to help get them where they want to be, essentially.
And you were able to coordinate all that. That's an amazing skill.
Well, I mean, it was a bit daunting. So he actually, I should say, he shares the office space with me. So we have a very different work setup. It's not like your own like whole clinic. So it's funny to have like an accountant and like a chiropractor in the same
building.
Yeah, Dad used to call it tax and backs as a little home joke. And I was like, no.
Tax and backs.
Yeah. But it then meant that I was there when he was having his stroke. We got onto it really early. It happened when we were at the office, and I think if I hadn't moved in to be next door to him, he could have been by himself all day.
Oh, no.
You know, so at times I think, is sharing this office space with my dad going to make me look less like legit, less credible? And then I think about that, I go, I've got no regrets now. Like that decision itself has already paid off for himself, because like my dad's still here, he's really healthy, he's going well. But
and
then
you're
also
able to impact that as well.
Yeah. And because we are very like family-centered practice, I don't know, like people are totally fine with it, and they've gotten to get to know my dad, or they'll, talk to him while I'm in with someone and stuff. So
you've created that environment.
100%. Yeah. And that's, priceless.
Yeah. Oh, for sure. Especially having your dad next door.
Oh, 100%. Yeah.
It's the best. And obviously you got the brand, you got the clinic, you got all those things. What drew you to chiropractic in the first place?
So I always knew that I wanted something where I'm having like a rapport with patients. Like I definitely am too energetic to be in a sedentary, sit on my bum all day kind of job. I've got too much ants in my pants for that. So I always knew that I wanted to be doing something where I would be intellectually stimulated by having like a rapport with patients. And then at one point I think I was tossing up like, would I do this, or would I do like, for example, like speech pathology? And I thought, I'm probably going to, at some point, regardless of if you're going to end up there as your like normal work setting, I thought, in the speech pathology setting, for example, there are going to be things that I see that no matter what you do, some people aren't going to go well. Like say you're doing like a post-stroke ward, and people are like learning how to swallow again and how to speak again. Like I think I'm too much of a softie to handle like that kind of stuff all the time. And I wouldn't want to learn to be okay with like to compartmentalize too much. And selfishly, I do get a good amount of endorphins from having a relatively quick turnaround, right? Of like when you look for people, it's not, I mean, obviously, yes, you're thinking about that long game, but to be able to have someone walk in and they're having some sort of issue that's impacting them from feeling great to then after that session already feel different. Like to have a bit of that, like I think that's great.
So rewarding.
Yeah.
And you would get that pretty often as well.
Yeah. So a little bit selfish, but I also like the idea that like I really think you can easily help like at least high 80s, 90% of like the people that you see. And
that's a
the
big
other
percentage.
and the other 10 to 20%, like we said before, where you'd be sending them to the next person. Like a lot of the time, there's just happy that you still listen.
Them.
Oh, 100%. Yeah. So, I think that that's really what it comes down to, is just the fact that I get to help a high amount of people. Like that sounds really nice. I get to meet people from all different walks of life and have that like rapport with them. And I've been so lucky where I've seen people like trying to fall pregnant to then becoming pregnant to then having their babies, and then I start to look after them and their babies, and it's a full
that is so cute.
Yeah, it's so wholesome, and that's what I really love.
You see the full circle.
I do, yeah. And it's nice to be on the sidelines, like seeing them as they're doing all the things that they want to do. It's great.
So it kind of fell into place to become a family practice then?
Yes, yeah. And I think
it's making a lot more sense now.
Yeah.
The whole journey.
I think sometimes like we almost become like our own avatar. Like sometimes we just attract people that are in that same stage of life as us as well. So I do recognize that, but I don't really think that I'm ever going to get to a point where I'm like, I don't have babies anymore. Don't want to see them. If anything, it's like, well, I don't have young children in my house anymore. Yeah. How great that I get to get a little endorphin kick and I get to see all these little babies, but then I also 100%. Don't have to like change their nappies and worry about their school bills and all that kind of stuff too. So it's good. Yeah.
Because we had someone on the podcast, he's a PT himself. He's definitely evolved. He's been a PT for I think 15 years now.
Yeah.
And when he first started his career, he was helping younger men in their early 20s because he was also at that stage. He was in a footy career, and that's the avatar that he was attracting. Then over time, so this is now, he's attracting an audience of dads and people that are new dads that have put on some weight and they want to get into that stage of getting healthy again. And he's noticed that over time, his avatar's changed to suit his stage of life as well. Exactly what you just said.
Yeah, because people want to know that you get it. Like all these people have like technically had similar level of training up until some point. Like obviously you've got to do more stuff after you graduate, but if you're all given roughly the same like core tools, what makes you different from the other person? And I think sometimes it's the fact that you get it because you're there with them.
Yes, and you've been through it yourself.
Yeah, like I think explaining to someone what the throes of like teething is like, for example, it doesn't hit the same when someone hasn't had kids and they've had a full night of sleep and kids are not on the agenda or anything like that. Like I think, knowing that who you're talking to and you're confiding with your health understands where you're at and genuinely gets it because they've also probably been there themselves.
Yeah, there we go.
Did motherhood change your approach to your care, like with your clients?
I think so. Like I think it also so for example, like prior to having my own kids, yes, I saw mums and babies, but then also after like experiencing breastfeeding, that's when I was like, okay, like I need to do even more on this because that was also then like a new area
that you never touched on before.
Yeah, like we did bits and pieces, but then personally experiencing that or understanding how challenging it is then meant, okay, I want to add more in here to support people with this because it's definitely not easy and it's not always natural to everyone. There's a lot of hard work that goes behind making breastfeeding work. It definitely changed how I practiced in some ways. And I think it also just meant that through personal experience, I went, okay, I want to, like I said, improve the breastfeeding outcome side of things, but then also like I had aquanatal, which was like pregnancy safe aquatic fitness during my pregnancy. And I was like, this is great for me. Like I can feel the difference. I want to then add that into what I do and offer that to people as well because more people need to hop on that train.
100%. And I feel like what I've noticed in a lot of research is post-pregnancy, they don't really have the right people teaching them about ab separation and the post-care that you should actually go through once you have babies and stuff like that. Where do you step in that stage? Would you step in like pretty much straight away or?
Yeah, and I think it even goes before that. It even goes into pregnancy.
Also pre.
Yeah, so you're telling them like all the things that you're doing right now, like how you get out of bed, like from your side, that's reducing pressure in through your core.
Yeah.
Just because the baby's come out of your body, you still need to be moving as if you still were pregnant initially. Wow. So I think it's also about letting them know towards the tail end of the pregnancy what's up ahead because there are other things that are going to be new challenges. And I think the hardest thing, especially postnatally, is because when you are pregnant, you're doing all the appointments, you're doing all things because it looks like it's homework for your baby.
Yes.
And of course you love your baby. You're going to do everything that you can do.
Yep.
But the moment you give birth to the baby, you are now not how your baby's going to improve because you're channeling it into your baby.
You become like the second
put yourself on the bottom of the food chain, right? Because a lot of society thinks, oh, to be a mother, you're selfless, this, that, the other. And yes, of course, you would do whatever you would give up whatever you need to give up for your child.
Yeah.
But also at the same time, I like to say, if you're not feeling 100%, how can you give 100% to your family, to your kids?
That's a really great
so
message.
you owe it to them and yourself.
To be in the best health yourself.
100%. Yeah. I think 0 to 1 in terms of no kids to having your first child is always really tricky because you've got this like identity shift that's happening. And I think of people a lot of the time like mourn what they perceive that they've lost. And then it can come down to fitness, right? When you go,
like
I used to be
pre-pregnancy body type thing.
Yes, to now where you are at now. But sorry, I realised that I kind of skimmed over your question about the postnatal side of things. Depends on their training. But then, I would say if you're lucky enough to have that patient come back to see you in a relatively small span of time, then you would start then and you would be assessing to see, okay, do we need to send you on in? Because it's not just, you've passed your 6 weeks clearance. You can deadlift now. You can do all the things. You need to be able to
hit the gym again.
Hit the gym again. Yep. You need to start postnatally at the same level of exercise you last left off when you were pregnant.
Oh wow.
Yeah.
Okay, I didn't know that.
Yeah.
Because I feel like the message was rest and recover.
Yeah, yeah. But then when you start to feel like you want to go back into training, you're not lifting up the same amount of weights that you were lifting up before pregnancy.
Of course.
You're lifting up the last set of weights you could comfortably do when you were pregnant last.
Ah, okay.
You know what I mean?
Yes.
Yeah. So that's the difference.
Makes a lot of sense.
Yeah, rest and recovery, very important. Very important. We don't want to overlook that because sometimes people do jump the gun. They want to do all the things early.
They go straight into it.
Yeah, or they want to go into calorie deficit because they want to get their body back or whatnot. And depending on if they're breastfeeding or not is going to change how that goes. But you still have those pregnancy hormones in you for at least 6 months, longer if you breastfeed.
Oh, wow.
So that tells me whenever you stop breastfeeding, you add 6 months and that's still what your hormones are going to be. They're still going to be like figuring out what's going on. You're going to feel, you're going to feel more stiff, but that's actually because a lot of your ligaments are still quite lax from those pregnancy and breastfeeding hormones. Wow. So it's a really interesting thing because it's not, and I feel like this is the thing that kind of makes me like cringe a little bit when I look at what's out on social media. You're seeing these like pregnant Instagram models that, you know, just look like how they are with the bump or whatever. And they're training as if it's just them, but they've got a body weight. But it's like, no.
Yeah.
Even down to like your blood vasculature, it's all so different right now because you're pregnant. Like you need to be able to talk comfortably throughout exercising when you're pregnant.
Yeah.
And you're not supposed to do any breath holding when you're pregnant. And then even when you think about how certain people lift certain weights, there is a component of either breath holding or bearing down, which is not great if you want to keep your placenta nice and happy.
Yes.
So it's not just about the technique. Be like, oh yeah, they can still deadlift because they're doing the technique properly. They're not going to hurt their back. It's also just like, okay, but
there's all these hormones that come into
hormones. Are they holding their breath when they're doing it? Because a lot of the time people are doing that. Or if you're doing anything like high intensity and you're moving your arms really quick, it is natural for us to breath hold.
Yes.
So being mindful of those things as well when you exercise during pregnancy, but also postnatally because you're still vulnerable, right? You still have had a lot of changes in through your body and that takes time. And I think that's the hard thing. Like we're so used to things coming quickly and we do have this like warped perception of reality because of social media, 100%, where our body's like, they don't care what you've seen on Instagram. They have their own timeline and that's the hard thing for us a lot of the time is because like obviously we want to know, but
how quick it's going to be to get back into shape.
Yeah, and it's also like what you've done in that lead up also determines how you're going to go for your recovery as well.
100%. What I've noticed on social media when it comes to pregnancy, there's all these fitness influencers that are able to bounce back really quick. And I know that's exactly what you just said before, but how would someone that isn't a fitness influencer or so go through that? They would see something like that and then not realize why they're not able to do the same thing.
Yeah,
why are they able to do it and not other people?
Well, I think it's such a multi-faceted thing, right? Like if you've got people that are, let's say professional model.
Yeah.
That is their, like how they look is their job.
Yes.
So they're going to have time, they're going to utilize support to get to that goal because that's impacting their ability to
earn money,
right? So you're going to have people that probably have some sort of help eating in a particular way. They might have a dietitian. They might have, you know, like a PT that's going to be, it's like that's
Pricing a
that's
chiro
their
every
thing.
week as well.
Yeah, or else if you've then don't have much support, you don't have much help, you probably not always making the best choices because you're just in the throes of surviving and you've just gone through all these different changes. That's tricky. And what I would also say is you need to be aware of what you're looking at
Yeah.
and how that's making you feel. If there's a certain influencer out there that makes you feel uncomfortable or like
Not like yourself.
it's okay to like mute them or unfollow them because like you're not there right now and that's okay.
And it doesn't affect them.
Yeah, and the timeline is different. But if you're consuming all this stuff that is then, it's this paradox, right? Like you're watching this stuff that makes you feel not great, but then the algorithm is thinking, oh, this
loves
person,
it.
she's watching this whole thing.
Yes.
I'm going to send her 5 more of these videos because she's watching it. And then meanwhile, how you're feeling is snowballing because you're like, everyone around me is this certain way and I'm not there. And I think that's a really tricky thing. I think also you need to be mindful of how that really impacts your mental health. Like obviously for your first time round, you don't really know what to expect. So you are kind of blindsided by that a little bit. I think now at least people are starting to share a bit more authentic experiences, but even with that, it's still
They're
selective.
still going to show the really good side about those bad experiences anyway.
Yeah, that's right. And they're still going to do the whole like, we've got this, you know, whatever it is. I think you got to tread the right line with like the toxic positivity side of things as well, because I think you just need to see like what out there is actually helping. And if it's not right now, like I would be muting some of those things.
100%.
But yeah, our bodies are all so different. And I think, I mean, like I personally had that a little bit as well, but I think it was probably a compounding thing. But yeah, there was definitely a chunk of time where I felt like I was in a stranger's body for a good chunk of time. But I don't think that was the thing.
Yes.
I think like that felt like a metaphor for like all these big transitions where your friendship groups are changing, your work dynamics are changing, your identity as a woman is changing as well. You're on mat leave. Like when have you ever like not been financially independent before, like dependent before? Like, so you had like all these different moving parts. And then on top of it, when you look in the mirror, you don't really see what you used to see.
Yes.
But
you feel different to what you feel like yourself.
Yeah. So I think also being aware of like how much is like reasonable and how much is something where, okay, like if we're looking at the perinatal mental health side of things, it's also important for our partners to also know, okay, like do they need to like speak to someone, like, because this is going beyond what is expected of baby blues, if that makes sense.
Yes.
Yeah.
Do you believe that personal trainers should have this level of knowledge about prenatal, postnatal?
I think so, if they want to be training women in that industry,
In that area.
for sure. I feel like, you'd be doing yourself a disservice, right? If you weren't, I mean, if you don't
Upskilling
have
in that way.
Yeah, if you don't have those clients, then of course you don't need to do that. But I think if you're expecting to see women in that stage of life, I think yes. Yeah. And there's not much out there, which makes it tricky. I think we need more out there that's going to help give people the right tools, because if not, what are they relying on? Social media again.
Yeah, and they fall back onto the social media chain.
Yes. So yeah, I think definitely PTs need to, because it's not just them with basically like a medicine ball strapped to their belly. It's a different thing.
Yeah, for sure. With chiropractors, a lot of people think sometimes of them as a last resort. How do you go about changing people's mindset on that?
I think it kind of depends on like who it is. Like the irony is usually the first time someone sees you, most of the time, is because they're in pain. So you're already on the back foot, because that's the reason why they're there. It's not like you're chasing peak health or peak fitness at that point. So I think it does come down to education. I think a lot of it is also how much we educate people even on our platform, so that people go, oh, actually, didn't even think that stiffness is a sign of things not being 100%, and maybe that is enough for me to go in. Like I tell people, do you put petrol in your car only when it's not even the yellow light, when it's broken down in the middle of the road? Is that when you put petrol in your car? Or do you put petrol in your car a little bit earlier, obviously. And then also, what's going to be cheaper? Do you only service your car with a mechanic once you've driven it into a pole, or do you have routine checks? Or same with your teeth. We get our teeth checked
Every
twice
6
a
months.
year.
Yeah.
No issues there, but you don't wait till you've like chipped a tooth to go and see a dentist. You don't wait till you're blind to see an optometrist. We still know that you should have these like independent checks. So I don't know why there's still this like misconception why people go, oh, I shouldn't get my body looked at, because we use it all the time.
Yeah.
So you recommend that people actually do routine checks with their rehab professional, and that doesn't matter if it's chiros, physios, whoever they kind of rely on.
Yeah,
They
like
should do
I
routine
think
checks.
you still need to be ethical. Like I think, you shouldn't be someone that's like, yeah, we need to see you 3 times a week, every week, forever.
Yeah. I've heard of people that do that though.
Yes, and it makes me cringe. And sometimes I feel like I have this chip on my shoulder where I have to prove that like not all chiros are like whack jobs.
Yeah. But
Because I
that's
feel
also
like
physios
there's,
as well. I know physios
Yeah.
that do that as well.
yeah,
That's the thing.
and I mean at the same time, like I'm a straight shooter. Like I don't bullshit with my patients. Like,
Yeah.
and I'm not going to string. I want to be able to sleep at night. I've got kids as well. Like I wouldn't want someone like, I would give them the knowledge and communication that I would be wanting if the shoe was on my
On the
foot.
other foot. Yeah.
Yeah. If my daughter did need to come in really frequently because whatever it is, and I understand why, that's great. But then I wouldn't want to be, dragged along if it was not going to
needed
be
sort of thing.
beneficial.
Yeah.
So I think every now and then it's always good to kind of get some sort of reassessment just to see where you're at, because sometimes like our brain is wired neurologically very differently. So
Yes.
it is very pain orientated, and that's a survival mechanism, right? So if you have for example, like a bad elbow back in the caveman days,
Yeah.
you could still run from a tiger or whatever hypothetically and live hypothetically, right?
Yes.
But if you can't say
Like
if
that
it's-
flight or flight
but
response.
say it's your neck. If you can't turn your neck to see that there's a problem there, you're probably not going to survive because you didn't even know the threat's there.
Yes.
So like even with things like our neck, particularly if you have a neck injury, how your body responds to that is going to be so different to like a sore finger or a sore
Yes.
thing, because it's not survival orientated. And
Whereas that is
and our brain is fixated on finding what's wrong, what's hurting. It doesn't go, oh, these 50 things feel really good today, because in terms of survival, it's not going to serve you well. So similarly, like I say, like that's why babies, for example, they cry from the moment they come out, but they don't smile from the moment they come out. And the reason why is because that crying is going to trigger this response that's going to keep them alive. Their parents are going to pick them up. They're going to soothe them. They're going to
Cradle
keep them
them,
close. They're going to feed them. Or else if you've got this kid that can't verbalize something's wrong and they're just smiling at you, they're not going to go well in terms of evolution, right?
Yeah.
yes.
So, similarly, our brain is just fixated on like what's on our top 3 issues that are not great. And then the moment you address that top issue, your brain's not thinking, oh,
Not
that's
worrying
gone now.
about
It's
it
thinking,
anymore.
oh, but now I've got this issue and something else. So it's
okay.
also retraining to look for those softer signs. So that could be like if someone's got a tight glute or a hip and it means that their foot is a bit more externally rotated, like that could be their tell. It's like that, it's not hurting them, but obviously over time, then
That's
yes,
gonna
they can
cause
get knee and hip
problems.
pain.
Yes.
But just also getting that insight within yourself to kind of know, okay, like what are my tells? Like what are the signs that I'm having that means I'm probably overdue for a check of
checkup.
some sort?
Yeah, that's interesting. So
Yeah.
the average person should just do routine body checks themselves. If they start to notice that there is some sort of pain or limitation in the body, they should reach out to some sort
Yeah, like say you're doing Pilates and you go, okay, like this single leg feels a certain way, but this right doesn't. Or I do thread the needle and I'm feeling like I'm not getting a full range of motion on one side, but I'm not having the other. Like even for us, it would be so easy for us to look in a mirror, look left, look right. Is it the same amount? Look up and down. How's that feel? What about side bending? All those different things are like easy ways that we can obviously see.
Yeah.
And then, basically going from there. So, I mean, it's cheaper long term to be more preventative than reactive a lot of the time. But that's the
Yes.
hard thing because there's not these clear signs that, you're due
Yeah, that's
for.
the thing.
Yeah.
Exactly. So to the average person, should they book in with their rehab specialist twice a year like they would for a dentist?
Yeah, minimum. Yep.
Minimum twice a year, yeah.
I think depending on what they've going on. And the answer would be different depending on what they do for work, what are their triggers, their life, like what's going on. So even for parents, I say your first year and a half is so ergonomically challenging because your child is like learning to do all these things from scratch. And a lot of the time it means that your demands are different. So when we think about the capacity and the demands, all of a sudden your demands are different and your capacity might be the same, but because more is being asked, it's struggling to handle that.
Okay.
So it kind of also depends on where you're at as well. But yeah, I think time goes by so quick, right? So even if I say quarterly, if it was based on this last quarter, that'd be so quick. So yeah, probably at least, 6 months or so, have a little check because there might be things that have either regressed or you might now be ready to take it to the next level. And how are you to know that you can take that now because you haven't had that reassessment, right? You've probably been like, okay, like this is challenging for you back then, but now look, here you are. Do you want to do more? Let's go there.
You spoke about in a previous podcast that you made about maintenance care and self-maintenance care. How would you coach a client of yours that comes in on self-care and maintenance care?
Yeah, so I think what I normally do is we really want to reduce barriers for them doing stuff, right? So sometimes I start small and we go, okay, like let's do this one little thing and tack it on to an existing habit, right? So if you're at work and you're putting on the kettle to make a cup of tea, maybe now's the time to do a single leg, stance or do a stretch or whatever it is. Like find a way to tack it on to something that happens all the time. If you're at a red light, like maybe now's the time to work on your deep neck flexors and just push your head into the thing. Like
habit stacking.
Just, habit stack it. And that way it doesn't feel, if they think, oh my gosh, I've got to get changed. I got to go to the gym. Who's going to watch my kid? I got to do all these things. They've already lost all this time because of that mental load that's already on them. So you start small, you give them those little things, and then it's also working within what's comfortable for them. Okay, like when your newborn is doing tummy time, maybe that's time for you to be on the floor and you can get the foam roller out and you can do these things. So I think sometimes part of my job is also to see these little opportunities for them because right now their laser-like focus is like on the baby. Yeah. And then it's just about like, okay, let's give you these things to do in that meantime, essentially. I think things like sleep when the baby sleeps is like a stupid thing to say because not everyone's going to want to have a nap at 9 a.m. But then if it's like, okay, well, instead of sleeping, how about you try and have a break from gravity? Why don't you lie down next to the baby while the baby's sleeping or something so you can give your pelvic floor a bit of a break? Finding all these little things to start prioritizing your health. And I think it's also sometimes tricky because if you think about typically like a father's experience of having like a new child, typically versus like a female's perspective, it's a little bit different.
Very different.
We're going to work towards having some equality, okay? But even little things, right? Like you don't have to my husband doesn't really have to announce that he's going to go to the toilet. He just gets up and goes, right? Whereas for us, it's like, oh, can you watch them so I can do this and I can, I think sometimes it's also adjusting like there's a basic level of human rights and like hygiene that shouldn't have to be like, oh, you treat yourself. You washed your face today or whatever it is, right? Like you've also, got to kind of address that as well. But coming back to that question, I think it's just about, trying to start small and then grow on that. Because if you looking ahead, like it's so daunting, right? You go for a long walk and you actually know you're going to end up like where you are. Sometimes it's easier just to be like, oh yeah, we're walking here first and then we're going to the next step rather than thinking we're going from here to here. So start small with the rehab, give them those little things, kind of habit stack it, snipe it in throughout the day. And a lot of the time with how our brain works, but also our body, is it's not really about duration. It's about frequency.
Yeah. So
I would rather someone do short little 1-minute bursts of things throughout the day and they do nothing and then they do like a 10-minute cramming. Like it's our brain wants that frequency and that constant reminder basically.
Yeah, that's something very similar that we find in our industry is that habit stacking is very, very important for running a marathon or going for that walk or brushing your teeth. We spoke to a previous guest on PTs and coaches and the difference between the two. Do you find that there's a difference between a chiro and a chiropractor, like a good chiro and a good chiropractor?
I think everyone's going to have different like red or green flags.
Yeah.
And I think what's tricky is you've got lots of different like modalities within the profession. So it's great for chiropractors, for example, because you can pick and choose what modality you like doing, right? So if you want to do dry needling, you can add that in. If you want to do something else, you can add that in. But then, yeah, I think it's going to be on a case-by-case basis. But I would also say it's also a gut feeling too, right? Like someone should be able to look at you in the eye and be like, this is what I found. This is what I propose we do. I've obviously got to keep in mind what your goals are, right? Because at the end of the day, you're the patient.
Yeah.
You're the boss. And that's the same with anything else, right? If you're pregnant and you're seeing an OB, it's still your body. So it's still about you. It's not just about what they would
what
prefer.
they believe sort of thing.
Yeah. So after this person is getting from you what your goals are, they're justifying what they want to do, and then you're making a plan together because you're a team. You're not.
For sure.
It shouldn't be like a dictatorship relationship.
It's
so
not
I think
a boss and employee type relationship.
Yeah. And I think when it comes to the public looking out, like have a look around, look at their qualifications. Like for me,
look
like
at their experience.
Yeah, look at their experience. It sounds weird, but even like if you look at their social media, like I think now we're at this day and age where you should be able to suss out if they're your cup of tea or not from looking at even things like their social media or even their website. Are you actually seeing what they look like on there, or is it all like eye stock images of like, people running in a field or whatever? Because that's not. I feel like those kind of things feel like
that connection point.
Yeah, that gives me a little bit of like a tingle where I go, is this a catfish experience? Like
is it AI?
Yeah, like who's this person? So I think it also is about finding who you think you're going to click with. And the cool thing is, like, for example, if I've had someone that's checked me out on Instagram, they know what I'm like. They kind of know what my communication style is like. So even if they then come in, there's already a higher chance that we're going to hit it off well because they've already sussed me out. Like I haven't sussed them out, but they've sussed me out. And so at least you've got two chances. Where else, I think Google, it's like, where are you? Are you free? Are you nearby?
Yeah.
Like, are you free to see me now?
It's a different type of relationship.
Or how much do you cost? Like, I think that's also the tricky thing too. So I think you're looking at, if it's very gimmicky, right? And they're like, oh, you're going to get all this value coming in for like $5. If it seems too good to be true, it probably is. Yeah. And I don't really feel like you need to financially incentivize people to come in and see you. And you shouldn't have to financially trap them. Like some people are like, oh, we think this problem is going to take, 20 sessions to get better. We need to see you twice a week full of time. How do you know? Do you have a crystal ball? Like this person could respond, they might not need that much treatment, but they also might trip over on the street once they leave your practice and then they've got a new injury. So I think also for me, like ethically, I'm very like, okay, there are a few things that I find like are a little bit of a red flag. Like not everyone, controversial as well, not everyone needs an x-ray when you see them.
Wow.
Like,
whereas other practitioners would say
other practitioners, they won't even touch you until they do an x-ray. But I also think
x-ray first. Yeah.
But like, is it justified?
Yeah.
Like, of course, some things you're like, oh, sounds like you might have a fracture. Sounds like you might have this.
To me.
Let's follow it up.
I went to a physio up the road and I was like, okay, my ankle hurts. I just injured it. They go get an x-ray, go get an MRI. I was like, whoa.
But even with that, like some things you need like actually, 10 days plus to actually see the extent of that fracture on imaging. So it's also the timing and it's also thinking, is this image going to change the course of treatment? Because if you would treat the person one way, but then it'd still be the same if you're umming and ahhing between these two conditions, then it's not warranted. Whereas sometimes it can be used as a scare tactic. They go, oh, see this bend here? Like it shouldn't really look like this.
It shouldn't look like this.
We need to get, and I also think, I'm sorry, depending on who watches this, but I feel things like that is preying on people because ultimately like our health is everything. It is our wealth. It is our currency.
Yeah.
It's not something that we can buy. It's not something we can replace.
Yeah.
So when you've got someone that's trying to prey on that and manipulate that for a financial gain,
It's very sad.
Such an ick.
Yeah.
Do better.
Oh, that's an ick.
Do better. Do better.
That is
Such
a
an
big
ick.
ick.
Yeah.
Because I was sitting there going, an MRI? No
But
way.
then is that also this person hypothetically not confident in their history taking?
Because you question that.
And their diagnosis to ask you the right questions. Like a lot of the time you should know what the diagnosis is before you have a picture of it.
Yeah. And it's weird. It
And
blows
even
my
like
mind.
disc issues, right? It's like,
Yeah.
well, hypothetically, like this disc could have been on your imaging ages ago. Doesn't
But there
mean
could
that's
be
what's-
multiple factors as to why
Yeah.
as well that
Yeah.
happened.
Don't get me wrong. Some cases it really doesn't make a difference.
Yeah.
But also we have the training to be able to ask the right questions to get the right answers to then nut out what you think it is before
So that's the
you
thing.
even
I feel
think
like
about
you're
it.
very like that. You like to really dive into someone's.
down.
Yeah. You like to educate. You like to really find out about that person before you start the treatment as well, which is why you mentioned a lot about goal setting, finding out about the long-term plan, short-term plan. Whereas I know from personal experience that some rehab professionals tend to have a method that they follow, whether that's dry needling, acupuncture, cracking the spine, whatever it might be. And they just do that on
Yeah.
repeat for every single client.
Yeah.
And they're just in and out. Okay, they're doing this method, and they go and give you a rehab plan, whatever it is. And even though they haven't even asked you or cared to ask you about what your actual goals are and how your body works, that's just what they think works, and they just go through that process. And I feel like that's maybe the old style of rehab. Correct me if I'm wrong. Maybe that's how they were taught back in the day. But I feel like talking to new or younger chiros like yourself, I'm noticing it's very different how you guys coach.
Yeah, I think it's kind of morphed over time. And sometimes you get different philosophies that also then impact flow. So that can also be a tricky thing as well, because sometimes people do want to have a particular method for assessment, which is totally fine, because at the same time, if you're doing the test because you need to do those tests, like having a flow makes sense, right? You're not going to have someone moving around like a rotisserie chicken. 1 minute you want them standing up to do a single leg, and the next minute you want them sitting down, and the next minute you want them on the tummy.
Yeah.
So I think in certain ways, obviously a flow is efficient and good, but I don't think, like, you still need to be able to, like, if someone audited you tomorrow and there was like, what did you do to this person and why?
For sure.
You still need to be like,
Explain
I found all
why that
these
happened.
things. I did all these things because of that. And then someone else needs to be like, that sounds reasonable. Or else,
Can you get audited in that way?
Yeah, you can. Yeah, you can get audited. I think it's something that most of us with APRA like we always get worried about getting audited. But yeah, it will come down to, like, obviously all your legal stuff. Like, is your insurance up to date? Like, have you got your first aid up to date? All that kind of stuff. But then it's also been like, have you done all your continuing development hours? So you need to make a commitment that you're going to be continually. Yeah. So there's a lot of stuff that goes into maintaining
your qualifications. and your brand
You should
and
want to
stuff.
do it. You shouldn't have to complain about it.
Yeah.
That's
Well, you
part of
mentioned
the
at the
job.
start of the podcast that you love upskilling, you love educating yourself constantly as well.
Yes.
Yeah.
And it's so important. I think, it's unfortunate if you don't really learn a bit more, because aren't you passionate about it? Like, don't you want to know more about
There's
it?
another
Don't you
ick.
do all these
People
things?
that don't educate themselves.
Yeah, people go, oh, I can't wait. I don't have like anything to study for ever again. It's like, yeah, but it's not like, no one like froths on exams, right? Like, that's not a comfortable experience a lot of the time.
Yeah, no one loves that.
No one loves that. But what's stopping you from, like, reading up on a research paper or getting knowledge from someone else? Like, they could have this way of doing something that would be great that you could kind of morph into what you do.
100%.
Or watching a podcast.
Watching a podcast, upskilling, very important. And there's a lot of stuff that needs to be self-taught. And for me, it's not like I'm reading research papers every time I have a free moment. It could be listening to podcasts. It could be, doing a like online masterclass on something else that's business related. Because there's we don't get any business training with our course. A lot of the stuff that is pretty much just, you've graduated, we think you're safe, you've done all your qualifications, like all the things that you need to.
Now go fly.
Don't kill anyone. And
I've heard someone say that exact same phrase before.
And it was kind of like honed into us, right? It's like safety first, which is so funny when people go, chiropractors are like so rogue. We're also like, we've been like drilled into be so safe. But I think, we had to do a lot of self-education to get to a point where you can like have a business or understand how Medicare works or understand what private health funds want from you or clinical note taking, all those kind of things like you should be working on doing as best as possible.
Yeah. When it comes to all that kind of stuff.
Make sure that you like, comment and subscribe. And if friends are interested, share it around. I wanted to ask about your prenatal class, your swimming class.
Yes.
Tell us a little bit about that.
So Aquanatal is a pregnancy and postnatal safe aquatic fitness thing that you can pretty much do from, well, originally it was about 14 weeks, but now with more research, we know that you can, if you feel fit and fine, you can start as early as you want and you can go up until your waters break. So it's one of the very few things that is appropriate for all stages of pregnancy. And that's a great thing when you've got the properties of water because you can kind of dial up and dial down what patients need. But then it's a very comprehensive course. So only, I think from memory, no, I'm pretty sure, only 3 out of 10 pregnant women are getting the recommended amount of exercise.
Wow.
Really?
Yes.
3 out of 10?
Very low. Pretty sure it's 3 out of 10. I'm pretty sure it's 3 out of 10.
That's a very small number.
Very, very small number. And especially when we have things like gestational diabetes on the rise, that's a whole other thing. Exercise is so important. Safe exercise is so important. So being in the water is the perfect thing because it's pelvic girdle friendly. So there are some things
low impact.
low impact, low joint impact. And through doing that class, it's very comprehensive. So like, of course, we do our warm up, but then we also talk about like our pelvic floor. We also look at postural awareness. Then we do a bit of cardio. We do a bit of strength conditioning. We do a bit of balance work. And then we finish off with relaxation. And then embedded in through there is also things like birth education.
Wow.
But it's so nice because they get to meet people at the same stage
of the pregnancy.
Because a lot of the time there might be like the hospital might put together like a mum's group that is often like after the fact, and it's like you birthed in this hospital at the same time, and you might not necessarily like have much
gel with them
else in common with that person. So Aquanatal is really good because I'm also in the water with them. So it's not the same as like an aqua aerobics class.
Where they're standing outside.
Yeah. And also what we do in that class has pregnancy in mind. So when you're pregnant, you shouldn't be exercising in water that is not between 28 degrees and 33.4.
Oh.
So very, very exact.
Narrow window.
Yeah.
So hydrotherapy, not appropriate for exercise when you're pregnant.
Okay.
Yeah, so there's all these different things, and it comes down to, pregnancy and how we lose our heating through there. Also with that resistance, that workout effect. So you won't get that kind of delayed onset muscle soreness from an aquanatal class compared to if you're doing weights or you're at the gym, because the water also helps with that swelling side of things, that fluid retention side of things as well. So it's a fantastic way for women to keep active during pregnancy, and that ultimately is going to improve birthing outcomes. So you want to keep people as mobile and comfortable during pregnancy as long as they can, and that's also going to reduce things like how much medication or interventions that they might need, right? So if you've had someone that's been pregnant and has had all this like back pain, and they haven't done anything about it, and they've just been marinating this problem for months and months and months, babies bulking, getting bigger, problems getting harder. Yeah. Do you think when they're in labor, they're going to be like, yeah, I've like feel comfortable? They're going to be like, give me the drugs now. Induce this baby, get it out. I'm so over it. So by keeping them comfortable, it's not only impacting how they feel during pregnancy, but it also gives them more energy in the tank for when it's time to deliver babies, especially with first, when we know that the labour is a little bit longer, they'll have more in the tank, right? So
that's interesting. And that's all down to the exercise.
The exercise, keeping them mobile, but also like through that, because we want them to be able to talk comfortably throughout the class.
Yeah.
So the women are talking, they're asking me questions, or they're asking each other questions. And through that,
You're building more of a community there.
Yep, there's a community there. There's the education, right? They go, oh, I'm having this issue. We go, oh, okay, like maybe this is now when you need to see a women's health physio because you shouldn't be having this at this stage.
Yeah.
Or, oh, maybe you should ask your OB about this particular thing because it doesn't sound like you have all the answers that you want now.
Yeah.
Or people go, oh, does anyone have a recommendation for a, great massage place? And I'll be like, yes, these places are great. So it's that community, but then you're also making them more feel more prepared for birth as well.
For the next stage, yes.
Yes. They feel empowered because it's not just, hey, you're pregnant, you need to cop this for all this time. It's like, yep, this is great, how exciting, let's give you the tools so that you enjoy this pregnancy. And then you have a good birth.
Yep.
Because at the moment, and this was prior to COVID, 1 in 3 women will experience some form of birth trauma, whether it be physical or mental. So, and I think a lot of that also, and they also know with the research, like a lot of that also comes down to education before. A lot of people, if you feel blindsided by something or you feel like you didn't have all
it's going to stress you out.
Yeah, or that practitioner didn't give you all your options and you felt like you had no say in how you birthed your baby, that also impacts how they feel about it. So by hopefully having this, not only are they like exercising and they're doing something for themselves, but they're also giving future them a bit of a gift as well because it will also help promote with recovery because they've kept active throughout pregnancy as well.
Wow, I feel like I would want a manual on how to go through pregnancy because there's so much information that you've provided us.
I'm working on it.
It's all happening in the background.
Do you notice that people that have done a lot of exercise pre-pregnancy, like before even thinking about having a baby, go through pregnancy with a lot more ease than someone that probably didn't do as much?
Not always, because sometimes we get people that, especially in your first trimester, say,
you've
got so many hormones that are running through your body that even though you haven't even started to pop yet, you're getting people that go, I have hip pain or I've got pelvic pain and I'm not even showing yet, like what is going on.
Yeah. And that's before anything.
And that's, and because pregnancy opens the door for old injuries to come back.
Oh, wow, okay.
Yeah. And the timeline that you have in your first pregnancy may be different to your second or third pregnancy. You might be like, oh, okay, I only had pelvic girdle pain in my third trimester. Now you're pregnant with your second, you're getting that pain in your second trimester. Because that timeline's been moved forward because your body's done it before, but then your body's like, oh, yeah, I remember I was supposed to do this, and it kind of jumps the gun a little bit. It is, when you've had someone that has been really active during pregnancy, it's also what kind of activity. Have they been a heavy weightlifter this whole time? And then they've had heaps of morning sickness, which isn't just in the morning, it's potentially ruthless the whole time. Which has then changed how comfortable they feel. So then they have had all this time off training. They feel like they can only stomach heavy carbs or heavy starchy stuff. And then that makes them constipated or whatever it is. So they have all these other new things that come that can also be, just because you were really active then, it doesn't always mean that that is what you can carry on into your pregnancy. And it's the first time that we really have this prompt for some to actually listen to their body. Whereas before we've been able to push ourselves, do all these things, but pregnancy does kind of force you to tune in because sometimes if you're overdoing it, you won't know there and then that you're overdoing it. You'll find out that night or you'll find out the next day.
Oh,
so that's an interesting with pregnancy is that you won't always know in that moment, I'm pushing it by doing this extra set.
Come later.
Yes. Yeah.
We need this manual. We need this manual. And it's good for you to be openly speaking about it and obviously give us this opportunity to speak with you because we're 25 going on 26, 27. It's eventually going to happen, but to educate ourselves this is really good. Would you suggest first time mums to go to a aqua aerobics class?
Oh yeah, aquanatal. Yeah, definitely. We've got people that have formed lifelong friends from going to class together, and that's really nice. But I think even for me, so when I was pregnant with my first, I was doing aquanatal, but I wasn't an instructor yet. So I didn't get to have it in my third trimester because the pool would be closed over winter, and I had a winter baby. Whereas for my second pregnancy, because I was teaching, I was doing it twice a week, every week from the moment we conceived to pretty much the week or two before I had him.
Oh, yeah.
And
All the way through.
all the way through.
Wow.
And that's the great thing about aquanatal is it's appropriate for all the way through.
Low impact.
Low impact, yeah. And it made such a world of a difference in terms of swelling. He was like still over 4 kilos, so he was like half a kilo heavier than my daughter. But that pregnancy and that birth, far better.
Really?
Yep. Yep.
That's
So it's not
awesome.
always just it's downhill after your first one. It's also like having those tools so that you can,
Do you feel like
make those decisions.
Yeah. Do you feel like in the beginning of, having kids and becoming pregnant, you heard a lot of those heebie-jeebie stuff and it kind of threw you off a bit? And how did you approach those?
I think I've got the hard skin for it because it's like stuff that I've always like kind of advocated for.
Yeah.
So that wasn't too much. But yeah, I think it was also tricky because, in some ways, like I definitely made choices that weren't always the most conventional of choices. So like I had my son in my house. I had him, we had we had a home birth.
Yep.
So that in itself is like not every day that happens. So even doing that when you've got like, middle-aged aunties that are like, oh, okay, that's really brave or that's really rogue. It's like, but I'm not doing it solo. Like I've got 2 medical professionals that are like there. They know what they're doing. It made more sense for us at the time. And the outcomes, like when we actually looked at the stats, the outcomes were actually better for me to be at home than for me to be anywhere else, essentially. So I think the fact that I've kind of already done things that aren't always what the norm is, I think it's just
a black and white road in there.
Yeah. And it's a case-by-case thing, right? So like what is perfect for someone might not be perfect for the next person. But yeah, I basically didn't want to die wondering. Like I had my first birth in a hospital setting and I couldn't help but think, I wonder if my outcomes would have been a little bit different if I had done it differently. So by the time I had my son, I was like, no, I got to walk the walk. We got to like see. And it was like a chalk and cheese experience. Obviously it's not for everyone. But that's when you go into your history and you go, okay, like, oh great, you had a vaginal birth the first time. So statistically, you've very high chance of having that again, or else maybe the answer would have been different if you had a really complicated previous birth and then, but ultimately it's still your body, your choice. So that's also something that most of us have to keep in mind, that it's your baby, it's your choice for what you want to do as a pregnant person, but also for what you want to do as a mother when this baby comes as well.
Yeah. And what's the main message that you would pass on to mothers that are about to have kids or about to fall pregnant?
That pain is not normal. And just because you're pregnant, it doesn't mean that you need to accept having a certain level of discomfort throughout the whole pregnancy. Yep. There's going to be a component that is biomechanical, and we can work through that.
Oh, yeah, okay. Yeah. Because I felt like the message out there is just push through pain. Yeah.
And it's weird, right? Because at the gym, people associate pain with gain a lot of the time.
Yeah, no pain, no gain.
Yeah, and then when it comes to birthing, everyone wigs out at the thought that there's going to be potential pain.
That's very true, actually.
That's so true.
There's like this lady that says people should give birth in the gym more because like people have this expectation that like
No pain, no gain.
pain is positive because you're working towards something. It's
yeah.
like, when you're having contractions, you're also working towards something. You're working towards having your baby
Giving
come out
life. Yeah.
and meeting them, right?
Yeah.
So it's different to like when you have food poisoning and everything feels suboptimal. It's a very functional
That's a different
discomfort.
thing. Yeah.
Yeah. But yeah, so I think that's also the difference between and it's just a mental thing, right? It's like what we associate with certain things, like, and it's pain's okay in this setting, but then it's not in
okay,
another.
no.
Like then we go, okay, we need to address why you have this fear around this kind of pain. Do you have enough support? Do you have enough education? Can some of those things be improved? And if so, how? Like all those different things, like ultimately, like you are the boss, you're in the driver's seat of your life and it's up to you to decide where you want to go.
You always call like your clients and potential clients the boss. Why do you do that?
Because for us, we're very patient-centered,
Yeah.
which is how I think it should be, right? And I think we've talked about before how it's not really a dictatorship mentorship, because then I think it'd be very like self-centered to be like,
Yes.
I want you to be like this. But they're
Like I said, the practitioners that say they have a method and all their clients follow the same method.
you're not a number, and
method
you're not
pusher.
just another cattle going through the
The system.
the system. you're your own person. You're going to make your own decisions because ultimately you're the one that's got to live with the consequences of the choices that you make.
Yeah.
Like at the end of the day, certain relationships that you have with certain practitioners are going to be limited, but you are still going to remember, like, even though you're going to have some people that might not recognize you from a bar of soap because they deliver babies all the time.
Yeah.
That person doesn't give birth multiple times a day, every day. So that perspective is different, and they're still going to be the one that remembers your name forever, and they're going to remember whether or not it was a positive or a negative experience.
Yeah.
That's why I say that all the time, because I think over time, typically, especially if we're going back to that pregnancy side of things, a lot of women are kind of taught to, you know, you've got to be this
selfless person.
You got to be this selfless person. You got to be the team player. You've got to be a good girl. You got to like listen to what is being told, because if not, you're going to be a bit of a pain.
But then you flip that and you're like, in my clinic, you're the boss.
Yeah, 100%.
Yeah.
They've got to sign off on everything. They've got to give me consent. They've got to feel comfortable. Because even if you think what you're proposing is like the best thing that's going to be for this person, if they're not comfortable with it, you're barking up the wrong tree.
And it's not going to work for them.
Yeah. So if we've got patients that don't want to be adjusted at all, right, because that does happen. Sometimes people don't want any manual adjusting. Even if you thought an adjustment would really make a difference, at the end of the day, they're not ready for that yet. And that's okay, because ultimately, like, it's their body, so they should be able to choose what they feel comfortable with.
100%.
You have a very open approach to your profession. Growing up, did you have any role models in the industry that kind of motivated you to open up your own clinic? And
yeah, so I was really lucky so my first chiropractic experience was when I was 15 or 16. My dad took me to his chiropractor when I started having some back pain with school. And I got to have a really great relationship with my boss. And then he ended up, I used to be like a receptionist on Saturdays for him when I was still at uni. So it was nice, because I remember this one time I was having this like crisis, and I was like, I don't know what I'm doing. In the bachelor, there's so much chemistry subjects. Like, I'm hating it. Like, I don't really feel like this is a reflection of like the career. And he kind of set me straight. But I also think that I kind of draw inspiration from so many different people in my industry and outside of my industry. And I think through having this collaborative approach is the fastest way to get to where you want to go. People have they've done all of the different journeys and stuff. Why not utilize their knowledge, get their opinions, and obviously you still choose what you want. So I think of it as like a buffet. Like, it's your plate.
All those options you get to choose.
Smorgasbord.
You pick and choose what you want on your plate. No one's forcing you to eat everything. But if I went to a buffet and they were missing like a dessert bar, I would feel ripped off. So for me, I'm like, I want to get access to like as much knowledge, and I'm as open with sharing as I am with asking for advice and opinions. And I feel like that's just,
the best way to live life.
There's no stupid question, right? You won't know if you don't ask. So
I never understood that when I was at school.
Really?
There's no stupid question. I never understood it. But then as I got older, I was like, that makes so much sense.
Yeah. And I think it also comes down to like finding people that you can trust, where you don't feel silly to ask those questions. Because if someone does make you feel like that, then they're probably not the right person to ask, right?
Yes.
Yeah. And there was like a saying that's like, people that criticize you are never at your same level or above you. It's always people that are not at that stage that are pulling you and criticizing you. Like you know what I mean? Like no multi-million-dollar whatever person is going to smash you.
Yes, bring you down.
And slag you, right? Because they're at a different phase of their life. Or sometimes
they'll only try to bring you up.
Yeah, or else if you've got someone that feels like threatened by you, or they're talking smack about you, like they don't matter.
Drink that cord.
They don't matter. Yeah. And I think it's taken a long time to be like, okay, like we're not for everyone. And I know that I'm not like for everyone as well. Like not all patients will potentially like me. I'm really lucky that I love a really high percentage, if not all of my patients. I'm so lucky that I have that. Whereas I know that other people might not be able to say that, but that's also one thing that I love about my job, is that I absolutely love everyone that comes in and I see. And that adds to why it's so rewarding. But I also know that if I'm not someone's vibe. That's totally okay. And
you're not for everyone.
yeah, and that's okay. Whereas I think when you're starting off, oh my
You
gosh,
try to get
they don't
everyone
like
in the
me.
door.
They don't
Yeah.
this and that, but they just haven't found their person yet, and that's okay.
And where was your inflection point where you went from chiro to a business owner?
So it was actually after I had my daughter. So I never really thought I'd have my own practice until after like my kids were at school. The thought of having maternity leave while having a business and still having overheads was actually really daunting. But it was until I had my daughter where I was like, oh, I need to do things my way. I need to have a little bit more of that autonomy. I need to have a bit more of that flexibility. And then, I thought if I want to be able to show my daughter that if she's not happy in where she is, to back herself and make it for herself, you know?
That's so cute.
Yeah. So, where I wasn't always like, they were just at a different stage of life, essentially. And there was this day I remember no one could babysit my daughter and I had to bring her in. And by then, like, she was basically like a cute potato with legs. Like, she couldn't do anything else, right? So she was just like in this little container, like doing tummy time or whatever. And the patients actually didn't mind, but I felt so self-conscious and so apologetic that I had to bring my child in. And I felt like, people are going to think I'm less professional because I'm a mum. And I almost had to feel like I had to hide that part of who I was at that stage. And that just didn't sit right with me. I thought, this is like such a privilege to be in this position. And I'm not going to, compartmentalize that part of my life. So that was when I thought, okay, I need to do things my way. And typically then it just kind of morphed and people got it. They enjoyed seeing eventually like my son having a nap in the pram at the front with the receptionist while I was taking them in, and they get to see how he grows and all that kind of stuff. So it was weird. It was like this one thing that I thought people would like criticize or think I was less credible because I was a mum was actually like my superpower.
Oh, there we go.
Yeah.
Yeah. That would have related to you a lot more. Course,
and it's like after you have children, it's like this this limitless cell gets like unlocked in your brain, and you think, how did I do all these things before kids? Because you become so much more efficient. How you think is different. Like I think a lot of people talk about mum brain like it's a deficit, but you get this clarity and this perspective of what really matters. And
you're in the driver's seat.
It's superpower, right? You just, you can do all these things. How did I multitask? I was like, I hardly was multitasking before kids, and now you're doing all these things at the same time.
They're doing 10 things at once.
100%, yeah.
Do you find it easier to approach clients with analogies?
I do.
When it comes to like injuries?
I feel like sometimes, because I think if someone doesn't understand what you're saying, you haven't said it in a way that they understand.
Gastrocnemius hurts.
Like I think sometimes people will not spend the time to educate their patients because they're like, they won't get it. That's such a cop-out. Like you just don't want to waste your time or spend your time explaining it to them. But taking that time in that moment is going to serve both of you better long-term because they get it, they understand, they're empowered, they're on the same train as you. Yeah. Or else if you think that they don't get it, like I'm not the smartest person. There's so many things that I don't know, and you can have patients that know more about their industry than you, but it doesn't mean that they can't explain to me what they do and vice versa. So I just think a lot of the time it's laziness where people don't spend the time to educate because that's not always the best financially. Like, I'm going to be slower when I see people. Still, you're getting less people coming in because you're taking time with them. So other places would be like, we don't want that. We want your numbers up. We want you to be faster. We want to pump all these people through, and that's just not how I roll. Yeah, and that's not really how I roll with the quick turnaround. Like I wouldn't be able to fit 3 people in a 15-minute session. Like that would just be wild, and expect to do my notes and do all these different things. So I think it just really depends on that person. But I use a lot of analogies because I feel like that's what they then understand. Yeah.
You being in the driver's seat, you take control of your car. What are some routines and rituals or habits that you provide in your life to maintain this level of upbeat, aura about yourself?
A few different things. So I think I've also realized that if I'm not mentally great or I'm not physically great, they both affect each other. So I've got rheumatoid arthritis, so I've had to kind of learn how to read my body a little bit more and I am aware of being burnt out, right? So I make sure that I'm looking after myself mentally and physically. So physically, I do Pilates now. I wish I subscribed to that much earlier in life because now like the low joint impact is really great, and to get that functional strength back, fantastic. Obviously, because I'm teaching aquanatal, I'm in the water twice a week, and I think that is the secret, one of the secrets to sending a peace offering to your body.
Yeah.
And I'm telling patients, if you don't walk regularly or whatnot, get in the pool. That's also going to do you well.
Just walking
That's
up
going
and
to help
down.
with age, 100%. Low joint impact. But also mentally, like every now and then I check in with a psychologist. I don't think that there's any issue with that or a stigma with that. It's so insightful to be able to have someone on the outside, you know, looking in and having someone to bounce that off. I think also I've got a fantastic village. I'm really lucky that I have a really supportive partner, a really supportive family, and I've got really supportive friends. And I think making that time to check in on them and vice versa, that also fills my cup. And I think that's also what's helped me, be the way that I am, because, you know, I definitely wasn't like this all the time. But I've been in those like last 5 years, I've been really able to finesse what works for me and let go of things that don't serve me. And I think for a long time you think, oh, like I owe it to this, I've done it for this long, but you can't always look at that stuff as a return on investment. I think sometimes it's okay to like cut and run if you need to.
Yeah, your priorities change.
Yes. And I think that's pretty much what I do, a little bit of everything, but I think that's just what I like, that novelty, I guess, that variety.
What's the biggest hurdle you've faced in business so far?
I think obviously a little bit of a different perspective because we still had to navigate during COVID. Like obviously that was a little bit tricky. I think the biggest hurdle at times is, like I said, like we didn't get really any business knowledge. So at times I feel like I haven't really been able to manage the cash flow well, if I'm being honest. I feel like I'm finally getting my head above the water.
An accountant as well.
I know.
It lives next door.
Yeah, but I think with that, like,
It's
you know,
also very
accounting
different,
is
though.
different to financial planning.
Big time.
Yes.
Like I kind of look at it as like factual documentation of what has already happened. It's not the strategies to move forward and to have a healthy, viable business.
Yes.
So I feel like for a good chunk of time, like you feel like you're getting your head above the water, you're building your cash reserve, boom, BAS comes, boom, super comes, different
have fun.
overheads or whatever it is, you know. So it's definitely improved over the last couple of months because I've been trying to actively,
Look
you know,
for those
be
things,
a little bit more preemptive with those things. But I feel like that realistically was the main thing because there wasn't really much training for that. I think that was the tricky bit, is just trying to manage cash flow and then also trying to figure out like where is the best utilization of your time and your resources, because it's very hard because things are either going to take your time to do or they're going to cost money.
Yes.
So
it's either time or money.
yeah, and then so you're figuring out what things are worth my time to learn how to do myself versus what things is someone that's their niche to let them do.
Yeah.
Like
you know.
offloading of tasks.
Yeah, offloading. Yep, 100%. Like by the time you figure out how to
Like
do
paying the accountant or
doing all those things, yes. And so I think it's a little bit tricky when you are a smaller entity.
where you don't have as much cash flow to be able to spend on
but also like
experts.
you can't delegate as much and you can't utilize as many people because it's like you're the content creator, you're the, you know, finance person, you're HR, you're, you know, all those different things. So I think it's about trying to figure out where to get those different things. But I feel like, like I said, because the business is still what I think relatively young,
Yeah.
I'm still in that growth and that learning phase. So that suits me fine for now.
There we go. And where to next?
Where to next? Gosh, depends on the day you ask me. So
It's a question we ask people at the back end of a
Yeah.
podcast, and we've gotten mixed results. Like some people will tell you what's next, or some people will say, I'm happy where I am right now.
yeah, I think you do need a balance. I think if you're always chasing the next thing, you still
Yeah,
need
you're
to be
never
able to
happy.
stop and enjoy.
Yeah.
And like my mum, she was always like a Energizer bunny, go-getter, doing all the things, 100 miles an hour. She would never stop. Or else I know that that's not sustainable for me. And I do think it also depends on where you are in your life personally as well. So my eldest, she's just started kindy. So I've kind of told myself this year is more about easing into this transition of school. But that being said, I do think professionally, obviously we want to just keep improving on those things. I've released a online course in regards to tummy time. So I would anticipate that we will be releasing a few more courses over time on different things like pelvic girdle pain and all that kind of jazz. I do want to, continue finding a way to educate people.
Yeah.
I feel like
pregnancy guide, I think, is in the works.
Yeah. We'll see how we go. And it just comes through like different waves. Like I go, okay, I'm going to write this stuff down and then I'm on to the next thing. So I think all those different things and just starting to feel like we can work on continuing and having, like I said, the viability financially as well to keep going and not be so feel like it's, month to month or
sort of
just working on. There's a book that which obviously I haven't finished reading, but it talks about having like a cash runway, and essentially it's like if you fell off a ladder tomorrow and you couldn't work, how long could you go paying all your overheads before you have to close your business? And when I first heard this analogy, I was like, holy shit, I don't have a runway. I've got like at best a driveway. Like I need to like work on like lengthening this bad boy. So I think, over time, just trying to work on getting the reserves in there to take off the pressure for then, like,
if
someone's sick and I've got to stay home and look after the kids because they've been sin binned from childcare or whatever, that I can be able to do that and not fret about,
not have any worries or stress.
Yes, I think so. I want to keep building more community-based stuff. I want to be able to give back more. I mean, we do a lot of like fundraising for certain things, and we have a thing called the Nappy Collective, so people can drop off their unused nappies and they get sent to women that have experience like DV and they might not have access to all those things. So, awesome. I mean, I always love doing community-based things, but I think it's also going to be community-based stuff, education, and just keeping my head above the water, and then eventually
elevating.
Yeah, I think so. We should all be evolving, right?
Yeah, exactly. That's why you're on the Evolve podcast.
Perfect timing. Perfect. Yeah.
Where can people find you?
You can catch me on Instagram. It is Dr. Amy Norman. A lot of people think of it as Dramey Norman, but it's Dr. Amy Norman.
That's what I thought it was.
That's the main place that you will catch me. Some of the other social media platforms still make me nervous. I get worried about getting trolled. That's the main thing that you can catch me on. And then you can also find me in my clinic, which is Dynamic Chiropractic New South Wales, which is just in Hurstville.
Beautiful.
Amazing.
Thank you so very much for coming.
Thanks, guys.
Thank you. Thank you, guys, for listening to this week's episode of the Evolve podcast.
Brendan and I have loved having you throughout this whole podcast. Make sure that you like, comment, and subscribe. And if friends are interested, share it around.
Yeah, make sure you share and tag us on your Instagram posts. And I'll see you soon.
See you guys. Little boogie to finish.